Good morning, everyone. Today we will be discussing necrosis, a key concept in pathology. Necrosis is a form of cell death that has significant implications in various diseases and conditions. In this presentation, we'll cover the causes, types, mechanisms, and clinical relevance of necrosis. Necrosis is an uncontrolled form of cell death that occurs due to severe or irreversible injury. Unlike apoptosis, which is a controlled process, necrosis often results in inflammation and affects groups of cells. It is crucial to understand necrosis, as it plays a key role in conditions like heart attacks, stroke, and infections. Necrosis can be caused by a variety of factors. The most common cause is ischemia, which occurs when blood supply to a tissue is interrupted, leading to oxygen deprivation. Chemical injuries, such as those caused by toxins or drugs, can also induce necrosis. Infections like bacterial or viral infections and physical trauma to tissue can also result in cell death. Lastly, immune reactions, such as in autoimmune diseases, can trigger necrosis. In necrosis, several pathological events occur. First, the cell membrane integrity is compromised, leading to the leakage of enzymes and cellular contents. This is followed by a depletion of ATP, disrupting normal cell function. Additionally, lysosomal enzymes are released, causing further destruction. Finally, necrotic cells trigger an inflammatory response, which can exacerbate tissue damage. There are different types of necrosis, each with distinct characteristics and underlying causes. The most common types are coagulative necrosis, typically seen in ischemic injuries, liquefactive necrosis, which occurs in the brain and abscesses, and caseous necrosis, commonly found in tuberculosis. There are also fat necrosis, often seen in pancreatitis, and fibrinoid necrosis, which occurs in blood vessels, typically due to immune-mediated processes. Coagulative necrosis is the most common form, particularly in the heart and kidneys. In this type of necrosis, cells retain their basic structural outline, but their function is lost. The cytoplasm becomes eosinophilic, and the nucleus undergoes changes like karyolysis or pycnosis. This is typically seen in conditions like myocardial infarction or kidney infarction, where blood supply to tissue is suddenly interrupted. Liquefactive necrosis occurs when the cells are completely digested, leading to a liquid mass. It is commonly seen in the brain, where ischemic injury causes neurons to break down. Abscesses, often due to bacterial infections, also show liquefactive necrosis as pus forms due to the enzymatic breakdown of tissue by immune cells. Caseous necrosis is a characteristic feature of tuberculosis. It occurs when necrotic tissue assumes a cheesy, granular appearance. This type of necrosis is seen in granulomatous inflammation, where the body attempts to wall off infectious agents such as bacteria. The tissue appears soft, white, and crumbly, resembling cheese. Fat necrosis occurs when fat cells are damaged, usually due to physical trauma or conditions like pancreatitis. It is characterized by the release of fatty acids, which combine with calcium to form chalky deposits. The process often results in a calcium soap formation, which can be seen on histological examination. Fat necrosis is commonly observed in adipose tissue, particularly around the pancreas. Fibrinoid necrosis is a form of necrosis seen in blood vessels, particularly in conditions involving immune complex deposition, such as vasculitis or autoimmune diseases like lupus. The vascular walls appear brightly eosinophilic on histology due to the accumulation of fibrin and immune complexes. This type of necrosis can lead to vessel rupture and hemorrhage. Necrosis is typically diagnosed through a combination of clinical evaluation and histological examination. A biopsy of affected tissue can reveal distinctive features of necrosis, and the type of necrosis can often be identified under the microscope. Imaging techniques, like CT scans or MRIs, can help detect areas of necrotic tissue, especially in organs like the brain, heart, and liver. Treatment for necrosis generally involves managing the underlying cause. For example, reperfusion therapy may be used to restore blood flow in cases of ischemia. In some cases, surgical removal of necrotic tissue, debridement, may be necessary to prevent further damage. Supportive care, such as pain management, antibiotics for infections, and antifungal therapy, may also be required. Necrosis can lead to significant complications. One of the most common is infection, as necrotic tissue provides a fertile environment for bacteria. Prolonged necrosis can also result in fibrosis, where scar tissue replaces normal tissue, leading to the loss of function. In severe cases, extensive necrosis can result in organ dysfunction or failure, particularly if vital organs like the heart, lungs, or liver are involved. In conclusion, necrosis is a pathological process characterized by uncontrolled cell death. It can result from a variety of causes, including ischemia, toxins, infections, and trauma. The type of necrosis and its underlying cause are crucial in determining the clinical approach to treatment. Early diagnosis and management are key to minimizing the impact of necrosis and preventing complications. This presentation was based on resources like Robbins and Cotran Pathologic Basis of Disease and other pathology textbooks. For a more detailed understanding, I recommend consulting these sources and research articles for further reading. Subscribe for more educational videos.